We will go ahead and get started. Thank you for joining us today for our Grief Sensitivity Virtual Learning Institute. This is the first of a two-part series. The second part of the series is November 12th and 13th. The focus of this institute is on supporting those individuals experiencing grief and loss during COVID-19 and beyond. We are so glad you're here today. So hello everyone, welcome. My name is Dr. Mindy Chadwell and I'm a faculty trainer for the Mid-America Mental Health Technology Transfer Center. I am pleased to be your host for this conference session and I'm excited to introduce this session entitled Beyond Sorry for Your Loss, Supporting Students in their Grief Recovery. I want to thank our wonderful speaker, Rosalind Kwong, for being here with us today. And a big thank you to all of you for joining us. We truly hope you find today's presentation engaging and helpful in your work. So to start off, I would like to cover a few housekeeping items. We have made every attempt to make today's presentation secure. If we need to end the presentation unexpectedly, we will follow up using your registration information. All attendees are muted for today's presentation and will not be able to share video. If you have a question for the presenter, please use the Q&A pod. If you have a comment or link for all attendees, please go ahead and use the chat box feature. The session recording and slide deck will be posted on our website within about 1 week, so you can look for those things. And if you attend at least half of the session, you will receive an email following the presentation on how to access a certificate of attendance. This event is captioned, so to view captions, click the arrow beside the CC box at the bottom of your screen and choose Show Subtitles. To change the size of the subtitles, click the arrow next to the CC box and choose Subtitle Settings, where you'll find the option to make the subtitles smaller or larger. And if you don't already, please follow us on social media and stay in touch with us. Okay, we just released a series of fact sheets focused on addressing various grief-related topics, including defining grief, responses to grief across the lifespan, preventive strategies and protective factors, cultural responsiveness, and evidence-based treatments. You can check those out on our Responding to COVID-19 Grief, Loss, and Bereavement webpage, as well as additional information for more MHTTC events and resources. We want to recognize that participating in this and our other sessions may activate your own grief and feelings of loss. As mental health care providers, we also need to care for ourselves. Please monitor yourself and practice good self-care, including taking breaks, stretching, drinking plenty of fluids, and practicing mindfulness or whatever helps you in staying centered and grounded. If needed, there are also links to helplines and hotlines on this page. These are also listed on the Learning Institute website. Our SAMHSA-funded MHTTC network focuses on technology transfer, which means the adoption and implementation of evidence-based practices for mental health across the U.S. states and territories. We develop and disseminate resources and provide free local and regional training and technical assistance for the mental health workforce. And here is our lovely map displaying the centers that make up the MHTTC network. We have 10 regional centers, a National American Indian and Alaska Native Center, a National Hispanic and Latino Center, and a network coordinating office. Please visit our website and find your center so you may stay up to date on trainings and resources offered in your region. And here's a quick disclaimer that this presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. The opinions expressed in the presentation are the views of our speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. Okay, let's get started. So we have an amazing presenter starting us off today. Rosalind Kwan is a licensed marriage and family therapist and is currently the clinical trainer and evidence-based practice coordinator at Hathaway Sycamore's Child and Family Services, a multi-service agency which provides services to children, youth, young adults, and adults in the Los Angeles County. At Hathaway Sycamores, the largest program is school-based services, where they have mental health providers on school campuses providing services to students and families. Rosalind holds multiple certifications to provide treatment, supervision, or training in different evidence-based practices, including trauma-focused cognitive behavioral therapy, seeking safety, positive parenting program, managing and adapting practices, and parent-child interaction therapy for children who have experienced trauma. She has also completed many trainings specifically in the topic of grief treatment, including childhood traumatic grief treatment, which is a model using TFCBT to treat childhood traumatic grief. So Rosalind, thank you for being with us today. I will go ahead and pass it off to you.
Thank you so much, Mindy. Such a great introduction. Hi, everybody. My name is Rosalind Kwong, a licensed marriage and family therapist. I'm currently the clinical trainer and evidence-based practice coordinator at Hathaway Sycamore's Child and Family Services. Next slide, please, Mindy. The Sycamores began in 1902 and founded as an orphanage, and Hathaway Children and Family Services was founded in 1919. In 2005, these two organizations, the Sycamores and the Hathaway, actually merged to form one of the largest providers of children's mental health services here in Los Angeles County. And today, Hathaway Sycamore's Child and Family Services provides comprehensive continuum of services to about 7,000 youth and families annually throughout the entirety of Los Angeles County. The agency currently provides services to children, youth, young adults, and adults across 7 of the 8 service areas here in Los Angeles, with services including residential treatment program, transitional living, foster adoption services, community-based mental health services, and as Mindy said, our largest program is school-based services, where we have mental health providers on school campuses providing services to students and their families. Our mission is to cultivate hope and resilience to enrich the well-being of children, adults, families, and our communities. I'm definitely not a stranger to personal losses myself, and I feel very privileged to have worked with many clients as young as 3 to some adults in their grief recovery process. And at Hathaway Sycamores, I have the opportunity to support staff and provide training and consultation to our clinical staff, and many of whom provide school-based services. You will have the opportunity to meet 2 of our clinicians in November as well, if you come back and join us. And I'm really honored to be here among some great thinkers. If you had been some of the keynote as well as other presentations, we're definitely learning from them and are benefiting from their work. The presentation today is based on what I've learned over the years from a lot of great thinkers, great support organizations, great therapists, including trainings from our house, which is the next track, who is presenting in the next workshop over, and a lot of experts from the grief community, as well as great trainers for play therapy and art therapy as well. Next slide, please. While we know that babies and toddlers, children and youth may grieve differently than adults, they definitely do experience grief. And grief and loss is such an important topic, as we've talked about all morning. Our topic today is beyond sorry for your loss. This is a phrase that it's very commonly used, and to tell you the truth, I use it myself because it is what we naturally would say, right? But it really makes me wonder why it is that it has become sort of like our default whenever we hear, okay, someone has experienced a loss, whatever loss it is. And could it be that maybe talking about death is just uncomfortable? Or talking about losses, is it uncomfortable? And saying, I'm sorry, is just a little bit easier. When someone says, I'm sorry, or sorry for your loss, our natural response is to say, it's okay. But is the person who experienced that loss, who is grieving, really okay? Or do they just respond with maybe a thank you, which is typically how I respond if someone says, oh, I'm sorry for your loss. Today, we want to think about how to go beyond that. And hopefully you get some ideas and some language to add to that, or even to replace that phrase. And what we hope to achieve today, it's on our learning objectives. We'll review some foundational principles in grief and loss, which I'm sure for many of you will be just a review. And we'll talk about some COVID-19 considerations. We'll also take a look at what grief looks like in students. We'll talk about some strategies to communicate empathy and to support students in their grieving journey in a way that is developmentally appropriate. And when we see each other in November, we'll then talk more about maybe our own barriers as providers in communicating empathy in our grief work. And then we'll also talk about interventions and strategies a little bit more, specifically those that can be used via telehealth. Next slide, please. So as we think about grief and loss, let's just start with principles, right? Feel free to type in the chat box. If I ask you the question, what do you know about grief and loss? I know this is a very broad question, right? But a lot of times when we talk about grief and loss, the very first thing that comes to our mind, even if you Google it, probably will be the stages. We know that in 1969, on Death and Dying, Elizabeth Kubler-Ross definitely introduced us to the idea of the 5 stages: denial, anger, bargaining, depression, and acceptance. And more recently, there are definitely more people that are adding to the stages, right? So some people would say before the denial, there's probably like a shock stage, and then after depression, before the acceptance, maybe a testing. I think that there's a lot of value in understanding what a person may be going through. And as I'm reading the chat, that's exactly what we're talking about, right? When we're thinking about stages, a lot of times what happens is there's the assumption, even though Kubler-Ross emphasizes again and again saying that the stages are not linear, but when we hear that they are stages, our mind goes to, okay, one thing must happen before the next. When in reality, Mindy, if you can click, please. This is what grief looks like, right? So we kind of jump from one to another, and not everybody's going to start at the exact same stage. And so as you can see, even though it gives us a good idea, but it seems to be lacking in some sense for us to fully embrace what grief is like. And so with that, instead, we started thinking a little bit more about the 4 tasks of grief, right? So William Walden definitely can come up with the 4 tasks, then is to shift away from thinking that things are linear. So we're now thinking about in his work in 2009, grief counseling and grief therapy, thinking that it would be important for every person that is going through grieving to accept, to process, to adjust, and then to reinvest in a new reality. Well, this is great, and I want us to keep that in our minds, that these are the things that we would need to do. Next slide, please. The issue still continues and still exists that if we consider grief to be something to conquer and to get over. It's almost like if we're thinking that there are certain tasks that they have to accomplish, it's almost like we have to conquer it and get over the grief, right? And in a sense, we're insinuating that there are only 2 options, either that we're eternally in grief and stuck, or we're completely healed and transformed. And a lot of thinkers started thinking about how we need a better story to live by. And I see that Carrie is mentioning how it's a lifelong process, right? Click, please. And in 2017, Megan Devine wrote the book, It's Okay That You're Not Okay. And in the book, she's basically wanting us to think about whether there's a middle path, whether than thinking that we're stuck in pain forever, or on the other end, to be completely saved and completely healed. What about we walk in the midst of this and stand in the midst of the pain, and not to turn away from it and embrace it? And it challenges us to rethink our relationship with grief. Instead of thinking of grief as a condition to be fixed, we're really looking at grief as a natural response to loss. And of course, we're looking at a huge cultural shift too, many of us probably remember. And the truth is, even now, as someone commented that, definitely culture plays a very important role. We know that it's still probably not very okay. And we grew up in an environment where it wasn't okay to talk about the loss or the grief. But I'm definitely seeing a little shift. And in 2018, the book that came out, Modern Loss, it's a candid conversation about grief. We definitely see that there's a shift in encouraging that conversation. We want to have a way of being able to tell the story, because that it's viewed as very important as a part of the grieving process. And with that comes a huge social media community. And we're going to talk a little bit about the pros and cons about that. But there are actually thousands of grieve accounts on Instagram alone. If you look up the hashtag grieve, there is 1.3 million posts. That's the last time I checked, probably more now. Hashtag grief journey, 64.5 thousand posts. Grief and loss, 146,000. Grieving, 217,000 posts. So we're really seeing that people are actually more okay in sharing and talking about what they are experiencing. And you start to see the birth of grief platforms, grief groups. And a client actually told me about grief dinner parties. This is when they will actually connect you with other people that have experienced same type of loss, that may have a better understanding about what you're going through, so that you will go to these dinner parties. And now it will be like over Zoom, where they get to connect, sort of like as a support group. There are a lot of takeover invites. There are accounts specific to different types of losses: mom loss, dad loss, pet loss, child loss, or relationship loss, and poems, photos, as well as quotes. There are 84.5 thousand posts if you look up hashtag grief quotes. So a lot of storytelling and grief projects. Now, the pros and cons, definitely we can find that social support, right? But the shortcoming of that is just that there are so many voices. If you follow any of these hashtags that I've mentioned, you would get an overload of feeds. You get really a lot of information. Now, how do we tease out what's helpful versus not? But it's a great cultural shift to see that people are actually starting to talk about it. They consider it important to talk about the grief as a part of their healing process. The key takeaway is definitely that grieving is a process, a natural response, right? And we should be encouraged to embrace the process. I still think that one can get to a place where you feel better and you're healing from the grief. And but it is also with the understanding that we're never really quite done, because you're never quite the same as before, right? So we don't want to assume that I can fix things. And so the last task in Walden's task of mourning is still extremely important, because you want to make the connection with the loss as you reinvent in the future, because you're embarking on a new life, but it's a new life without the person or what you've lost already. Randy Perlman Wilson and I definitely a great voice in the grief community, and I'll reference one of her children's book later too. She proposed that instead of using the word heal, maybe see it as a healing process, right? So think of it as a process of healing the parts of us that is on this grief journey together. Next slide, please. And of course, I hope that you've been able to listen to some of the great thinkers to make the connection, right? If you're thinking about grief and loss and COVID-19, we definitely know that no one will argue that grief and loss is definitely exacerbated during this time. It's complicated by anxiety and grief. Fear, anxiety and fear, because there are a lot of things that are out of our control right now. What is known about the virus is still very limited, right? We know what we know, but there's still so much of what is going on that's outside of our control. And Dr. Nadeau actually spoke about anxiety response in an earlier presentation as well. We also know that this is also a time when we're looking at multiple losses. We're working with the family that the kids actually lost both of their parents to COVID right now. And as you can imagine, we're talking about multiple deaths, but also along with the deaths, multiple losses, other losses too. We're also thinking about maybe kids that are transitioning into a new school. My nephew is actually going to 6th grade this year, and she's transitioning he's transitioning to a new school. The level of losses that he is experiencing without being able to physically say goodbye to some of his friends, and also like his principal has led him to actually look up his old principal's YouTube channel and looked at videos about his that were made by his previous principal. Definitely, we're also looking at isolation, and with the pandemic, we all know that we are feeling more isolated than before. Even with technology, we're able to have some sort of connection, but still, we know a part of the grieving process definitely requires us to be on the journey with somebody. And so the isolation just kind of complicates it. And of course, because of the limitation during this time, a lot of times there's lack of closure. We're not able to say goodbye. There's a lack of traditional practices and rituals surrounding funerals that we're not able to do. So it's definitely complicated by COVID-19, definitely. So as we think a little bit about that, I'm not saying that every child or youth is experiencing what we call complicated or traumatic grief. It's just the reality that some may. Now, what is complicated or traumatic grief? Unlike bereavement, childhood traumatic grief, it's regarding a difficulty with accepting or unwillingness to accept that the person has died due to the associations of the death with traumatic circumstances. And I hope that your minds are turning too right now, thinking that, I wonder if part of it is happening right now under the circumstances. What about difficulty or avoidance of positive memories because they're linked to horrible images and upsetting thoughts and feelings? When we think about complicated trauma, that is when trauma doesn't end and you cannot get back to your usual routine. So an example is when a child is abused for an extended period of time by maybe a primary caregiver, then you can't really get out of a situation and you can't go back to normal living. So once again, just thinking a little bit about it, how possibly complicated and how traumatic this experience can be for those that are grieving losses. I've listed a couple of EBTs, evidence-based treatment for traumatic grief. Of course, we won't have time to go into it, but I want to invite you to keep your trauma-informed lens on while we're thinking about how to support a student in the grieving process. Next slide, please. So now I think it will be a good time for us to do a little poll. I want you to kind of look at yourself and think about how well you can recognize grief in students. So I'll have you pick one of the 4 selections. I would love to see where we're at. And so this is when we will start to talk a little bit more about grief indicators. All right, so what will it look like? But I want to get a sense about, your own assessment. And Mindy, will we be able to see the results, or how would that?
Yep, I'm just waiting for a few more responses to
Okay,
come in.
great.
So we're at about 297 have answered.
Okay, thank you so much. I also see that a person has also commented too that, sometimes we have to wait till the person to tell us that they're grieving. If they tell you, yes, because sometimes it can be so difficult to miss, right? The truth is, if someone broke their arm, they will come to school with the cast. So you know right away. But how do we see grief?
And I'm going to go ahead and close the poll now.
Yes, definitely, Bernice. Some hides it so well. So I see that a lot of you think that you can sometimes pick up signs that may be grieving. And quite a few of you actually think that you'll be able to tell right away, even from a little bit further away. And hopefully in our discussion, it would help you definitely kind of think through what it looks like. But I'm glad to hear that many of you are able to sometimes pick it up. And the truth is, you For those that hide it really well, like Bernice was saying, sometimes it takes for us to be able to ask those questions too. So let's think through some general grief indicators, and I've kind of categorized them in social and emotional, cognitive and behaviors or physical, and we'll talk through it really quickly. Of course, if you go on Google and you actually look it up, you would find tons of resources out there on grief indicators in kids, but I want to highlight a few. I think that most of us are able to pick up emotional and social grief indicators. So when you think a little bit about it, we can pick up that if someone's looking really sad, or sometimes they're more irritable than usual, sometimes there's anxiety. I feel like that, we can probably pick those out, and we'll talk about age-specific indicators too. And one thing I want to highlight in terms of like social and emotional indicators is that because someone experiencing a loss probably feel a huge sense of loss of control. So with the loss comes a loss of control. And because of that, a lot of times we might miss it in a student when they have become a little bit more indecisive than before. Sometimes it's either way that they are making some decisions without really thinking through it, so really impulsive in the decisions, but a lot of times it may look like indecisiveness. So we can also think a little bit about cognitive indicators. And of course, it depends on development and also their cognitive ability, right? Whatever they're capable of understanding. But a lot of times in students, we see that they are really having a hard time concentrating. You may notice a loss of productivity. And something that I really like to pick up too is the loss of creativity, where you have a student maybe that used to be very creative, but when they have experienced a loss or when they're going through the grieving process, a lot of times they may not show the same level of creativity. Sometimes they can look like they're kind of confused, specifically surrounding the loss too. And in older students, sometimes you will pick up maybe overachievement. I'm not saying that everybody that has these indicators are grieving, right? But a lot of times they may be really, the loss may be driving them to overachieve or underachieve. And that all has to get tied in back into the nature of loss. A little bit on behavior. Definitely we have like, more acting out behaviors. We are actually working with a young child right now that because mom is going to the hospital to take care of grandma, non-COVID related, but the child is actually having a lot of tantruming, and the behaviors are really coming from the anticipated loss of grandma, but also that fear with not having mom around. And definitely we see also kids in terms of their behaviors avoiding maybe places too. That's pretty common. It's a behavioral indicator. And we have a young child that lost, the child that we talked about that has lost both of their parents to COVID, actually right now avoid the rooms where the parents used to be a lot. So there's avoidance in terms of places. Physical indicators, so we know that little ones with stomach aches, tummy aches. An example is that we have known of a child that after the funeral started blinking a lot. Right, so talk about physical indicators, and parents took him to the doctor and found out, we thought maybe it was allergies or what was it? It was like immediately after the funeral, the blinking started. And the doctor basically said, we think it's related to anxiety or like adjustment. So we're able to make the connections, probably the loss. And then we were able to confirm that because it got better over time. And then when the child actually had to go back to the gravesite to revisit, that's when the blinking started again. So we can definitely make connection in that sense. And a lot of times that comes from children that may not be able to express what they're feeling. So I want to start with us looking at the youngest kids. I'm making a reference to Toy Story 4. Bonnie in there, she is 4 years old in the movie. She didn't experience any death or anything, but she actually lost Forky, for those of you that watched that movie, for a bit of time. And some of the things that we see in there definitely it's a good reflection of what grieving looks like for a young child, because these are kids that even though they have words, right, they may say things, but they really cannot process what is going on. Definitely, we see a lot of difficulty getting back on schedule. And what used to be fun, it's really hard for them to get back to normal. And we often see a lot of separation anxiety as well. I want to stay home, and it's really challenging. And because they don't have the words to process it, we do see a lot of repetitive play about the death of the person or the feelings. I actually read of one person that said when she lost her grandparent at age 4, her parents told her that she actually took a stuffed animal to the toilet and made that stuffed animal throw up. Right? So that's the repetitive, try to use the play to sort of let us know that they are grieving the loss, right? So they may not be able to show us, but they are playing about the death, playing about the hospital scene, or playing about the person, or even feelings that they may be having. They may announce it, which is kind of interesting. I find that for very young kids, sometimes they may actually announce it. We had a very young child that was announcing it to everybody. They may announce it to the grocery store cashier. They may announce it to maybe someone on the street, or maybe someone in school. They would say, like, my mom died. And because they cannot process with words, a lot of times we do see regression in what is considered to be previously achieved developmental milestone, right? So they may go back to wetting their beds again. They actually cannot, because of their limitation in their cognitive ability, they don't really understand how things are irreversible, and things that are unpredictable is really hard for them. So sometimes they may believe that the person can come back, and they can do human things too, they think. Some may believe that death is a punishment. And remember, developmentally, this is a stage where a lot of times it's all about me, right? So they make the connection that maybe it's my fault. And I'll give an example a little bit later on too. Thank you, Mindy. Next slide, please. So let's think about what grief looks like for a little bit older. Now, I just want to say Simba, it's actually 3.5 when he lost his dad. But because lions only live for 10 to 15 years, what he was presenting with really kind of lined up more with like a school-age child. Nemo is 6, and I'm focusing not on the loss of mom because that happened before he became kind of aware of what was going on, but because when he was taken away in Finding Nemo, he was 6, and he sort of had some losses with not being able to be with dad. Dash in Incredibles 2 is 10, and the loss is more surrounding the fact that mom became extremely busy, and so all of a sudden dad was doing all the caretaking. I also wanted to highlight Lilo and Stitch. If you remember, Lilo also lost both of her parents at age 6. So that's what it looks like usually when they are around school age. This is more like the operational stage of development. By this time, they usually are able to understand that the person will not come back. They may still think that it's their fault, but they think very concretely. So if the person died in a shower, we have someone that had a loved one died in the shower, and all of a sudden she was having a very hard time. She was afraid to get into the shower. And because the thinking is very concrete, right? Especially in the younger stage of that age range. And they really don't have the social skills to communicate grief. And so because of that, they may be angry, irritable, and a lot of times you see somatic symptoms. And they act it out. And so at school, a lot of times you do see school problems. Avoidance is actually pretty common, and they have a lot of questions. It's not that they cannot think about what is going on, but it's just that they may get really, really quiet. We have a client that whenever they're talking about their person that they've lost, their volume when they're saying, my mom, would become very, very quiet. And the clinician noticed that whenever they're referring to the person that they loved that died, it would become very, very like a whisper. And just because of how difficult it is to talk about it, right? And sometimes it may actually take them a while to feel sad. And this is something that I definitely learned from Owl House. So a lot of grieving support out there for us to learn from, that for this developmental age, a lot of times the grief actually heightens about 7 to 9 months after the death. And so we have had caregivers coming to us saying like, but she doesn't seem to be really upset about it, so she must be pretty fine. But the truth is, for this age group, sometimes it doesn't get heightened until a little bit later, and also that sometimes the duration of the grief can look like it was kind of short, which is okay, but we also want to be careful about picking that up if they do have feelings surrounding that. So it's important to help the parents and the caregivers understand too. The last thing about this particular age is that always remember that the grief is evolving, right? So even if at age 7, when that happens, I usually do explain to caregivers that they might have to really reconsider it and really process it again at a later age, because they are only capable of processing it at the cognitive level that they're at right now. So it may be a little bit later that they'll have to do it. And as some has mentioned, it's definitely a lifelong process too. Now let's think a little bit older. So next slide, please. We're thinking about the preteen age. So Miguel, of course, like it was the family's loss in this case, but he is 12 in the movie Coco. Riley from Inside Out, it's 11 when the story happens, and the loss definitely for her, it's more of like the move. If you remember, the family moved, so she was dealing with a lot of the losses there in that sense too. By this age, they usually have a fuller understanding that the person will not come back. They also understand a lot better about how things are universal, right? So everybody dies. Excuse me. So they may have a lot more adult-like responses. So you see crying and sad, irritable, sometimes angry. Something to keep in mind for this age too is specifically about their development is their hormonal changes during this time. So they may become a little bit more moody. One thing that is really kind of fascinating about that too is how they consider this grieving process to be very unique to their experience. A lot of times we may hear things like, I'm the only one. I feel like I'm the only one that's going through this. In fact, in the books that I love that for young readers, it's called The Thing About Jellyfish. Now, this book talks about a person that has lost her best friend. And in there, she did say, like, no one notices, no one will understand. So definitely, as we can think about that, it's very isolating for them, specifically for this age. And sometimes they tend to blame themselves. Sounds familiar? So far, we've heard it, right? in multiple ages, they still blame themselves. And a lot of times for this age, we'll definitely see the impact on daily functioning. So if you're picking up on like eating issues, sleeping issues, that's what would be, that needs to be considered too. A lot of times it would be their difficulty in concentrating, and so their grades would drop. And this is where we see a lot of the impulsivity that I was talking about, or indecisiveness. Because things are just not within my control, right? When you experience some kind of losses. I did see that note. I'll definitely put that in the chat. It's also at the end of the presentation too. We have a resource slide, and we also have a handout that we'll be able to give to you, be posted after the event. So, but I'll definitely put the chat a little bit later on too. So let's move on to maybe teenagers, right? A little bit older. Now we have Ian. Of course, the loss happened once again when it's not the start of the movie, but he's 16 in the movie onward. And also Hero, if you watch Big Hero 6, at age 14, Hero actually lost his brother, and it was quite traumatic. And so there are a lot of traumatic response or grief response that we're picking up from these characters. By that time, of course, they have full understanding once again. But one thing I think someone has mentioned in the chat too is they may hide the feelings. So you see that, you get a glimpse of how they're sad and angry, but they're acting out, or they are doing a lot of risky behaviors, but they are sometimes doing a great job in hiding it. And one great indicator is that they sometimes worry about the future. And of course, like this is when we are faced with loss, there's definitely that existential part of us. Now we're not sure, what's going to happen to the future. We're not sure what's going to happen to me, but also like what's the meaning of life, right? So there's a lot of worries about future. And for this developmental stage, of course, there's the identity part, if you think about Erickson and the role confusion. So who am I? A lot of times to kind of figure out who they are, there's a tendency to feel responsible for others. So a lot of the teens may take on caretaking roles, or even, for the siblings, but even for maybe the other parent that's left behind. I love that the Dougie Center actually have a resource on their website, and the Dougie Center resource will be in a later slide as well. But in their teens resources, they have what they call a Bill of Rights. For this age, it's really important for them to have us give them the permission to grieve too. Right. So in the Bill of Rights, it talks about, I have the right to have my own feelings. I have the right to grieve. I have the right to not have to always take care of others too. So definitely something to keep in mind when you're working with that particular age. So let's go to the next slide, please. We're just going to take a moment. I want us to think a little bit about it because we've already presented, what we think about in terms of grief and loss, and then we talked about grief indicators a little bit. And now, if that's the case, what do you think a student needs from you and from me in their journey of grief recovery? And I know that some prefer not to use the word recovery, but I'm just using it in a sense with the understanding that you never really quite get over it, but it's a part of the journey. Now, if you can, feel free to type in the chat as well. What do you think the student needs? And of course, you don't have to type in the notes yourself, which is the next question. Go ahead and click that too, Mindy, please. Thank you. But what do they need from us? And I'm seeing a lot of things. A safe place to talk, trust, definitely. A safe space, yes, definitely that safety. I love it. Yeah, to know you acknowledge where they're at. Yes, compassion, validation, to be present. And I'm kind of nerdy, so I'll probably, after this, if I get a hold of the chat, I'll definitely be kind of studying everything. But I'm seeing like empathy, validation, right? That sense of safety. So many of you actually reference safety and empathy. Definitely understanding, and not necessarily for us to fix them or to rescue them, right? So let's think a little bit about communicating empathy. So next slide, please, Mindy. And I wonder, I was thinking about that. I'm like, I wonder if part of the reason why you're attracted to attending this workshop, it's the fact that, we talked about supporting empathy, communicating empathy, right? Because we all know it's been studied. Empathy increases treatment outcome. It increases the patient-student experience, and it also helps and increases our experience as a provider too. So empathy is really, really important because empathy helps us relax. We can all relate. If we have more time, I'll definitely have you think of the person that it's the most empathizing and what sense of feeling it creates within you, because it helps us relax, and it also increase our, and I find this really fascinating, because empathy actually increases our tolerance for the suffering that we're going through, right? So not only does it calm our system down, it actually kind of helps us have better resilience, and that's what I love about it. And if grief is a natural response to the loss, like we talked about, and if we seek to have a relationship with grief, then what a student need, it's someone that is non-judgmental, as many of you so nicely, beautifully put, because they need us to be non-judgmental. They need us to be able to approach the grief without judgment, and someone who's willing to be on the journey with them, and there's a relationship there that I'm really picking up on from what you're talking about too, right? So I want us to take a moment to watch this video. It's Brene Brown on empathy. Many of you might have actually seen this video, but I encourage you to kind of think through a little bit. We're going to pause and see what her take is on empathy.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, whoa, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Thank you, Mindy. So some of the things I want to highlight from the video, and definitely I agree with Kristen that, I love Brene Brown's work, and Tracy's saying connection, right? So what we're focusing on is the connection. When we think about empathy and Brown's take on empathy, it is to acknowledge that it sucks, right? But I am here. And it's not sympathy, it's not well, at least, right? And with grief and loss, because we may not have shared the same loss and the grief experience, it's a lot of times so unique and isolating. Many of us may not be able to feel exactly the way the other person feels, right? Plus, if you were to feel the same level of despair as every person you're working with, my worries is that you're going to get burned out pretty quickly, and we can't really sustain that. And so when I think about that in working with clinicians and providers on this, it's definitely to be able to find a way to communicate empathy in a way that doesn't drain you, right? So the concept of cognitive empathy may be a good thing for us to hold on. Brene Brown actually mentioned a little bit about that too, is to be able to do perspective taking. So I'm able to take your perspective about what the experience is like, but I'm not experiencing that exact same experience with you. There's one comment earlier too during keynote today. They were talking about how it gets exhausting working with someone that is grieving, right? So you're not feeling exactly the way that how they feel, and you want to acknowledge that. And it's okay to say, I've never been there, but I am here. I want to hear what it's like for you. I want to take your perspective on it. Now, the concept of cognitive empathy is perspective taking without taking on the emotional toll on us. And we want to understand what they might be feeling. And then we want to communicate that. We want to communicate compassion and acceptance. And that's why we want to think of the approach as more, how do I really give permission and validate? And how do I use a discovery approach instead of thinking that, these thoughts that you're having, they're not true or they're not right? Can we go on a discovery path together about some of the things that you're thinking about? And is that helpful for you? And also, can I communicate it in a way that I am on this journey with you? Next slide, please. So we're going to focus a little bit on helping students grieve. And I'm going to take you on this journey, moving back and forth, because we know that, again, we're not going to necessarily arrive at a place, but I want us to think it alongside your students to just think about the different parts in terms of their brain and their brain functions. And of course, just like how a brain functions, we're not really stuck in one part because there are a lot of interactions between the different parts of the brain. And then also too, just do a disclaimer, this is a very simplified way of looking at brain function. So it's so much more complicated than that. I'm not claiming to be a neuroscientist, and I just want us to kind of think of it as a way to anchor ourselves in our approach, right? And so we want to start with maybe what we consider to be a lower part of the brain, which a lot of times when losses happens, it creates a sense of helplessness. And we feel like that we lost that sense of control. People actually use the word unraveling a lot to describe loss, right? So it's really important to feel grounded. And we find the students in the survival part of the brain, because the alarm is going off. I'm in this danger part, and I'm thinking I'm getting ready to fight or flight, or I'm just frozen and I'm freezing. Right? So it's important. The very first thing that maybe we can do is to establish that safety. And again, it doesn't mean that after this point, we're not coming back to establishing safety, because we will come back and revisit. But let's start from there and think about how we can establish that sense of safety. And I propose that we can start with really giving permission to talk about it. And in some sense, maybe if we know about it and they're hiding it, it's to seek permission to talk about it. Now, how do we do that? It's important to be able to start to reach out, right? The thing is, it's really helpful for a student to know that we're not afraid to talk about it. And it's okay to say that, I know that you've experienced a loss, right? Because touching base with them will let them know that they're important to you and you're really acknowledging the loss and you're not afraid to talk about it. We may be tempted to avoid the topic because we may be thinking that, they're going to be fine. But anyone that has experienced loss can probably tell you that things change, right? It's not quite the same. So one of the first things to do is probably to be able to start to communicate that I know it sucks, right? And what you're feeling is normal. And when I was talking to a few clinicians that work specifically with death case, one clinician actually said if she can present one message about helping students in the grieving process, she would say the message would be the word death or dying or anything about that, or the D word, it's not a bad word. And the person's name is not a bad word. Right? So in order to establish that safety, we have to start by giving permission. Now, let's do another poll really quickly. I always ask you to do a self-assessment. Now, part of establishing safety is definitely to explain death. And we'll talk a little bit about what to pay attention to. So if I can have you go ahead and click and respond, how comfortable are you in explaining death to a student? So some of us among our participants, you may feel very comfortable. You may have no problem explaining it to a student. But some of us may feel a mild level of discomfort, right? Or is it just very uncomfortable? So as I'm looking at the poll results, it looks like 65% is identifying that there is a mild level of discomfort. But I think I can do it. Yeah, woohoo, yes, I think you can do it. I believe in you. I think we have like 27% that feels very comfortable. Kudos to you. Great job. I think that's a blessing, definitely, to students. And for those that are uncomfortable just thinking about explaining death, I hope that this will be a journey, Right, so we'll share some ideas today, and I hope that when we come back in November, we can also talk a little bit about maybe what the barriers are, right? So thank you so much for your participation. Now, when explaining death, let's touch on that a little bit. Of course, the task requires sort of adaptation because it requires the person to understand the meaning of death, right? And that depends on developmental level, the age of the child, or maybe whether they've had any context of loss, if they had previous history of loss. But a clinician's example is that we have a client that is right out telling the clinician, I want to die. So the family became very, very alert and they were really worried. But when we try to understand a little bit more about like what it was, the child actually said that, you know, I want to die, but there's like the next part of it because she said, so that I can know what it feels like. So the clinician then went on to be able to kind of acknowledge that you must be very curious because you don't know what it's like. But the thing about death is that once you do die, you cannot come back, right? So she ended up providing some psychoeducation about death and explain what it is. And that thought that the child wants to die, it's not there anymore. Right. So when we think about it, is to be able to really support them in knowing that we're not afraid to talk about it and I can explain it. And what we suggest in talking about death is to have honest and direct language. They have to be age appropriate, but you can definitely want to explain, right? Something like death is when a person's body stops working and they no longer breathe, think, or feel anything, and we'll never see them again. There are a lot of examples and I think a lot of resources about that, but it's really important to know that we want to explain that the person that they've lost that had died, it's no longer physically present and they cannot come back. And of course, religious explanations can be a part of your discussion. That includes the main concept of death. You have to explain that the person cannot come back, right? So one thing that a clinician had done with a client is to say that he died, and have the parent or the caregiver then say, and then please explain in our religion, what does that mean, right? But we want to use very simple language and correct language, and real language, as I call it. I think we need to use real language because we want to avoid euphemisms. We want to help them understand how the death occurred in some cases, right? Because we've had a little one that had refused to talk about the death for a very long time. And it took us a little bit of time to figure out, you know, what it was until one time she actually whispered to the clinician saying that my mom said that daddy now lives in my heart so he can hear everything that I say. And I don't want him to be sad because I'm sad that he's not here. And so when you think about it, right, when we use phrases that may have an alternative meaning, it may actually be very confusing. So for example, if we say, we lost grandpa, then a child's reaction is probably, let's go find him, right? We found that book that we lost. Why not just go find him? Oh, if we say she's in a better place, then the child may think the better place is actually here with me, right? She must not be very happy here with me. I don't know. Or he's sleeping peacefully, then sometimes you have a child that is really worried and staying awake because they don't want to die. And some of these examples I got from Randy Person Wilson as well. There are a lot of books and videos that would be very helpful with the process, and I suggest really making use of them. Now, in addition to explaining death, we want to normalize grief reactions. And a lot of times we think by communicating empathy, that's when it's not just you, right? We want to say we. We want to be able to say, we all experience this. We want to have the opportunity to do appropriate self-disclosure. And I think that it has become sort of like an important piece during this pandemic, is to be able to say that, you know, I struggle too, right? Because these are hard times for everybody. It's okay to do a little bit of self-disclosure as long as it's not about you, or as I say, as long as you come back to the student right away, that's okay. So it's okay to say, you know, I haven't lost my mom, but I've lost, you know, this person, but I want to hear what the experience is like for you, because it can be very different. So you want to normalize it. You want to help them understand what usually happens when someone lose someone and what grieving is like, but you also want to acknowledge how unique the person and the grief is, which is exactly what I think many of you have put in the chat, is to be able to really listen to them, right? Because otherwise they feel like their loss is being minimized if we say, oh, this is just the grief reactions. But I think that's important to cover the grief reaction so that they know that I'm not going crazy. And that's what I've heard, over and over again, sometimes from clients, is that, good, I know that I'm not the only one. That's helpful, and I'm not going crazy. But on the other hand, we also want to honor the uniqueness. Something to add to about establishing safety is, if the death was traumatic, know that establishing safety a lot of times involves establishing a safety plan. And hopefully we'll be able to kind of talk a little bit more about that too in the future. Next slide, please. So once we're able to deal with some of our sort of like survival things, and oh, sorry, let me make that the last slide, please. Sorry, I forgot about that quote. Now, one thing that Randy Wilson has said is that a lot of times if we just ask the student or ask a child how they're feeling, they may either tell you fine, or they may tell you, I don't know, right? So one of the ways in order to help ask them about their story is to actually ask the question, what did you love doing with the person that died? So a lot of times that kind of questions elicit a little bit more of a story. Thank you, Mindy. Next slide, please. So now that we have established some sense of safety, and again, that we definitely want to kind of come back to the establishing safety part. But once you've established some sense of safety, you can move a little bit more into dealing with our emotions, which is mainly, or like primarily, think of as our midbrain area. This is where we are definitely trying to understand the feelings. And so what you want to do is to start to identify feelings. And when identifying feelings, a couple of things to take note of to help a student that is grieving. One of them is definitely how, again, in terms of the loss of control that is involved in any loss at all, it's really, really helpful to make the connection between the feelings and the body. So what you want to do is definitely not only talk about the feelings, but maybe where they're feeling in their bodies too. Okay. And when you're talking about feelings, you definitely want to highlight the fact that it is okay to feel different feelings at the same time. So I know that I've been referencing this person a lot, but in one of the books, and thank you, Brittany, for putting that reference there. The book is called Eddie's Brave Journey, and it's about an elephant that's going through the grief process and just trying to understand about loss and understand about grief. And in it, Eddie, well, one thing to notice is that Eddie actually has the companion. So I would imagine all of us turning into the squirrel that goes on this journey, right? So now Eddie with the squirrel actually went on this journey, and they met somebody that's named Zoe. And Zoe is actually a zebra. And Eddie asks, Zoe, when I have two feelings, just like your coat, it's black and white, how do I choose between the two? Which one do you think is right? And Zoe said, I love both of my colors, Eddie. They're each a part of me. So when you have two feelings, they're both okay, you see. And I think this is one thing that is really important to communicate when we're trying to help students that are grieving identify feelings. I remember that when I first went to an initial training in grief, like many, many years ago, one of the things that gets stuck in my head is just that the emotions about grief, they describe it as a tangled ball of emotions. So it's not isolated emotions. And so if that's the case, when we're identifying feelings, we want to do what we call like a Zoe moment, right? We want to help them experience that it is okay to have multiple feelings, because they may be very sad. And I have a child when I was doing a color your heart activity, and I have her use different colors to represent how she's feeling when she was thinking about the person she lost. She came to me and say, like, for this part of my heart, can I use both my blue crayon, which represents sadness, and my purple crayon because I feel sad and I also feel happy that I have some, I remember us doing things together. And she turned to me and say, and that's okay, right? And that's a big part of me that feels like, of course, that's okay. So here in identification of feelings, definitely you want to do maybe things like feeling pies, right? Or color my heart that has multiple feelings. You want to honor that, or feeling soups. We'll talk more about that in November, maybe more ideas, but I'm pretty sure that you have ways of incorporating feeling identification in your work with students. And hand in hand with the identifying of feelings is definitely to cope with it, right? So we're thinking about breathing. And something to highlight is definitely maybe kind of tying in that body awareness too, is to help them know, have the body awareness about like tension versus calm, right? So could be imagine that we had uncooked spaghetti versus a cooked spaghetti. So being able to help them use coping that can help them feel a little bit better. Of course, bubbles or maybe different ways of breathing would be helpful. It may be also important if they have a lot of intrusive thoughts to help them think of ways to do a little bit of thought stopping. When in the middle part of the brain, so we're not really doing a lot of cognitive stuff yet, but it would be helpful for them to have a way to get into a zone of being able to stop that thought. We have a clinician that has like a little stop sign, and she asks the client to imagine whenever he feels like he's thinking about different things to see that stop sign in his mind. So these are just some things to remember when you're trying to help them deal with the emotions. One thing I want to say about the part when we're trying to deal with the emotions, definitely to respect how they grieve. You want to know that we can't really expect that they can keep processing for extended periods of time. They don't really have the emotional capacity, right? So you want to be able to incorporate breaks, but also maybe to establish a way for them to do self-monitoring, which is what I really love, because they need to be in control of the support that we're giving them. As many of you have referenced, we want them to be in control. So make sure you're developing a way for them to communicate how much they can take or what they can talk about. And we have clinicians that would use like a red light, green light, yellow light kind of approach and say, you know, when it's okay, we feel like we can keep talking about it, keep going, just tell me it's a green light. Yellow would be, I need a little more support before I can go on, maybe a little more scaffolding that I need. A red light would be, this is too overwhelming. And same thing when it's a younger child and they cannot really tell us, they cannot maybe rate from 1 to 10, of course, like older students will be able to do. I've seen some great clinicians doing like, let's use movement to show me, right? Are you feeling like, oh, I'm feeling so sad, I can't go on to talk about this, so I'm going to crouch on the floor and as a ball? Or am I feeling just like, okay, or I feel really confident right now, I can reach the sky, so let's keep processing, let's keep working, let's talk about this, right? So using movement, and also in play, being able to respect that if they're playing out what it's going on for them, and if they seems to be breaking away from that, that's okay. What you may want to do is to be able to kind of still go back and notice that, acknowledge that, and say, I see that you moved away from playing this. So I'm going to keep playing with this for a little bit and see if they will come and rejoin you. And if they don't force it. And I always believe that, they'll be coming back when they're ready. I will still probably have the same set of toys the next time so that they can go back to it if they choose to, but definitely make sure that you are respecting their journey, right? So a click, please. So one of the quotes that I've included for you, it's from a registered play therapist and supervisor, and she suggests using the word show me instead of tell me. So show me with your play, show me with your art, and if she wants to, if they want to, show us with the words, and that's okay, but definitely not to force it. In November, we'll talk a little bit more about how to incorporate breaks and also maybe activities that you can do in order to space out the grieving process a little bit. Next slide, please. So now that we have established a sense of safety, we've dealt with some of the emotions, the student is definitely a little bit more ready to move on to the last part of the, not the last, but like the next part in the brain. It's more like our part of the brain where we're using our thinking brain a little bit more, right? So this is when we are trying to make sense of it, when we're trying to figure out what to do and how to go on. This is the time when they're basically being very aware about what the before and after may look like and how there is a difference. And that's actually a very natural process for kids. How many times I don't remember that I've asked a child to draw sort of like a before picture, that many of them will ask for an additional paper and they will like very naturally draw the after picture so that we'll be able to see. But this is where you may have to do some cognitive reprocessing. And again, we'll talk about that, but I've had a client that when at the time I was working with her, she was 7, but when she lost her mom, she was 3. And she had definitely a big distortion that when mom died, it was my fault because I didn't remind her to take medication. And so it's really, really important to be able to know this is the time when you are going to go on a discovery journey with them, right? And you want to think about how to help them with more helpful thoughts, because now that they have established some sense of safety, they have processed some of their feelings and emotions about it, they may be in a better place to make sense of it. And we also want to think about getting their needs met, because if they're younger, they may be thinking, who's going to take care of me? And a lot of times there are a lot of secondary losses too, because if a child is very involved in baseball and the dad used to be maybe coaching or at every game, then they might actually be also losing baseball too. So we want to kind of think about that, how to get their needs met. One of my clients that have lost her grandmother used to go to grandparents' house all the time. But after grandma died, she wasn't going anymore. So we really needed to think about how to help the parents establish a new routine with grandpa, because otherwise she's losing also the connection with grandpa as well. So we want to think about how to get their needs met and also prepare for hard days. As we all know, birthdays or anniversaries are usually really difficult. A lot of times holidays are just very challenging. Thinking about a child that has lost a mom going to school on Mother's Day, it's extremely challenging. So we want to prepare for it. It will involve a lot of collaboration, maybe with caregivers, but also maybe other school personnel. It's important to work with the caregiver to provide the support that they need when they're not in the room or in the session with you. One good idea in this space of trying to help them make sense of what happened. Next click, please, Mindy, would be, this is from actually our house in one of their trainings. They suggest using the question, if you could see him or her one more time, what would you tell him or what would you tell her? So this is a good way to be able to help them really make sense of what the needs are, and then how to then make sense of what has happened. Next slide, please. Now, once you're able to go through maybe the different parts of the brain, you have been able to establish safety, deal with the emotions, and also start to make sense of what happened. This is where I would consider just our integration phase, right? This is where you're basically staying connected. You're maintaining the bond. Now, that picture I try to kind of recreate. It's an intervention that I found to be very helpful. With that, basically what you're asking the child to do is to be able to imagine themselves holding balloons. They may be holding several balloons, but there are also balloons that are floating in the sky. And I think this picture actually captures what we're trying to accomplish here really well, because what you're trying to do is to help them think through how they can stay connected. And what we would do is to ask the student if they can think of maybe things that they can hold on to. I know my grandma left the jewelry box with me, so something I can hold on to. I'm going to put that in one of the balloons that I'm holding on to. Or I know that I have pictures that I can go back to. Now I can put that in one of the balloons I'm holding on to. However, there are things that I'm not going to be able to still hold on to. And these are things that I want to be remembering. So these are things that I can put in the balloons that are in the sky. right? So there are ways that I can remember. I can't hold on to it. Maybe the scent, maybe mom's cooking. I am not able to ever taste my mom's cooking ever again, but it's something that I can remember. So these are balloons that I would put in the air. So we're thinking about two different layers. We are helping them to stay connected, right? We're trying to help them think of ways that they can maintain bonds. Again, we'll talk about ways to, or strategies to do that in November. But we also want them to know that remembering the person doesn't always have to hurt. It hurts sometimes, but it doesn't always have to. And slowly, you're basically really envisioning living on without the person. And how you do that is knowing that there are things you're holding on, and then knowing that things are you are remembering. And a click, please, Mindy. I'm going to leave you with this is a quote that in the book, It's Okay That You're Not Okay. The very last page, actually, of the book, it actually says that it's okay that you're not okay. Some things cannot be fixed, and they can only be carried. And this is basically the message of this part of the integration, is to be able to acknowledge that, you know, that things are not always, we're not always able to fix everything, but we can carry them for you, and we want to help you maintain the bonds, but we also want to just make sure that you are remembering things. And when you're going through this process, I'm here to carry you. Next slide, please. So I've included some additional resources. Now, besides the Sesame Street main webpage, they actually have some pretty amazing resources on Sesame Street in communities. And they have it by topics. You can actually look up different topics. And one of their topics is helping kids grieve. They have videos, interactive activities, and worksheets that you can print out, as well as articles for parents as well. So great resources there. And of course, I want to always reference our house. Tons of resources on the website. They have awesome trainings. The Dougie Center is actually based in Portland, and they do a lot of grief camps, but on their website there are tons of grief resources as well. If you do see a lot of stress response, and it's more traumatic stress that you are seeing in the child, the National Child Traumatic Stress Network definitely has tons of resources on traumatic grief specifically too. The Childhood Traumatic Grief web-based course is something that if you are trained in TFCBT, that will be a great resource to have, because they actually will support you in the implementation of TFCBT, but for childhood traumatic grief. And if you're an educator, I hope that we have some among us, that one of the developers of TFCBT, Trauma-Focused Cognitive Behavioral Therapy, Judy Cohen, has actually written an article that's called Supporting Children with Traumatic Grief. It's an article that she specifically wrote for educators. So these are some resources. You'll also find these resources in the resource list. Once the slides are posted, there will be a handout with all these resources as well. So I've listed some other books. The book, When Someone Very Special Dies, is sort of like a drawing book, which I really like because it explains death pretty well, and a child gets to draw in it to help them process the feelings. There is also The Invisible String. So as you're imagining how to maintain the bond, that book is great. There's Memory Box as well, which is a great resource. And of course, I referenced this book, which is called Eddie's Brave Journey. And thank you. I saw that the references there for earlier on too. So next slide, please. And these are just some references. And again, we hope that you'll be able to get the resource list. I also want to just let you know that our agency is our training institute is doing a school-based mental health training and consultation program for returning to school. So that handout will also be available with the slides when they become available too. Okay. So thank you, Mindy.
Thank you so much, Rosalind. Before we turn it over to the Q&A, I want to make sure, do you want me to administer this last poll?
Oh, yes, please. Sorry, I totally forgot about it. Yes, please. Thank you, Mindy.
Yes.
What do I do without Mindy?
Okay, go ahead and launch that.
Okay. Now that you've heard a bunch of stuff, I want to ask you to do a self-assessment again. So how do you feel about supporting students on their grief journey? And while you're putting in your answers, I just want you to know that actually there are quite a few other resources that have been put on there too. Thank you for the team. Thank the team for putting some of the resources, but I think some of the participants have also put their books that they have found to be very helpful. Okay, great. Now the poll results have come back, and I'll reference some of the tools that have been put in the chat box. But 57% of you, so over half of you, thinking that you're slightly nervous about it, but I'm more ready to be supportive. And I think that that's really, really important. I'm so happy. I'm like thinking that you're now feeling more ready to be supportive. And I think that's what the real thing is, right? It's just that you feel like I can be there to support them. I see that maybe 41% feel very confident, and kudos to you once again in supporting them in the grief journey. I hope that we've been able to help you think of something a little bit differently, because you probably know a lot about supporting students already. For those of you that feel uncertain about supporting students, what I'm hoping to do is that we'll be able to see you in November. I am really hoping that then we can talk a little bit more about maybe once again what the barriers are, and then we'll be able to give you some more hands-on tools that you can actually implement. Okay, so thank you, Mindy.
Okay, thank you so much, Rosalind. We appreciate you sharing your expertise. We do have several questions in the Q&A pod, only time for maybe one or two questions. So I will turn it over to Dr. Hannah West to lead us through the Q&A portion.
Thank you.
Okay, we've got a lot of really great feedback. We do have two questions. The first is, we in schools often get young children experiencing death for the first time, but more as a sympathetic response to a parent's grief. So for example, great Aunt Susie, who the child doesn't even know has died, but the reaction is significant. Is this more of an anxiety response to fear of death, or is this true grief?
I love that you're actually trying to kind of figure that out, because I think on a lot of level there is a difference about whether it is sort of their response to how other people are responding to the death, or is it their true response to the death, right? And I think a lot of times there are different variations in terms of how close they are with the person that has died. What we're looking at basically is the fact that any person that has experienced a loss, it could be really going through grief, maybe not grief of the death, which is the loss. It could be a grief to the loss of a way that the parents used to behave, maybe a way that the parents used to be able to provide the support that they did. So depending on what the parents' responses are, that might actually be what they're losing on and what they're grieving about too. So I love the fact that you are kind of distinguishing that, Sandra. But what we know is that for a very young child, right? So when you're thinking young child, I'm thinking maybe 5 and below. They may not have the concepts, they don't have the cognitive ability to really understand irreversibility. So in their mind, they don't really know, that the person cannot come back anymore. With that said, I still think that it would be helpful for them to know what death is by explaining it very simply, by being able to say like, hey, like you won't be able to see Aunt Susie, for example, anymore, right? Because the person died and the person cannot do what other living people would be able to do. And I would probably then follow up with, checking in. I wonder, if that makes you sad, or I want you to be able to maybe possibly tell me if there's something that you really missed about Aunt Susie. And that's how you can probably tell if the grieving is more about the loss or the death of that person. And being able to really understand that, having death it has certain common responses, and the child, even at 5 or under, can probably make connection that, oh, that's what my mommy is experiencing, right? So when we say that, usually when we have experienced someone that we lost or that died, again, D word is not a bad word, and I find myself using the word lost too. But when we say that, Aunt Susie died, and so people usually will have these responses, right? So it's like, I wonder what it has been like for you. How has mommy been? How has daddy been? So you might be able to get a little more sense about where that reaction is coming from. And I hope that is helpful in being able to know that, there is definitely a difference. So I love that you're thinking about it, but it really is depending on what is going on. But definitely acknowledge that sometimes it may be because of other things that they're grieving, but it's still a grief response.
Thank you very much, Rosalind. I know that we have about a minute left. So please, everyone, join us back for the November session, and we'll get more questions answered. Here is Rosalind's contact information as well. So lastly, we will ask you to please take a moment to complete a brief survey about today's session. Your feedback is very important to us. You will be redirected to the survey when you close the Zoom platform, and I believe the link will also be posted in the chat box. So thank you everyone for joining us today. It has been our pleasure bringing this session to all of you. Thank you so much, Rosalind. These are the next sessions that are available. So these are the optional breakout sessions. We have one for the grief sensitivity track, the school mental health, and the evidence-based practices track. So they will start at 2:15 Pacific time, 3:15 Mountain time, 4:15 Central Time, and 5:15 Eastern Time. So please join us for this networking opportunity. And just as a reminder, today's presentation slides and recording will be available on our website. Thank you everyone for joining us.